Assalamualaikum. This is part 2 lecture on persistent and intractable hiccups for ENT trainees and students with MCQ questions and answers. This part 2 presentation is formed of 50 evidence-based facts that forms the core knowledge for persistent and intractable hiccups, all extracted from part 1 presentation. You'll be asked whether any of these 50 different facts is true and any is false. This is basically an exercise to consolidate the knowledge from part 1 lecture rather than test your current knowledge. So we start with this first question, true or false? 1. A hiccup is an abrupt contraction of the expiratory muscles. 2. The distinctive hic sound is caused by the glottis closure. Number 3. Hiccup is an evolutionary remnant of earlier amphibian respiration. Number 4. The motor pathways for the hiccuping forms early during the fetal development, human fetal development, before the motor pathway of normal lung ventilation is formed. Number 5, premature infants, again human infants, spend 2.5% of their time hiccuping as their lungs are not yet fully formed. We have here one false statement and 4 correct statements. The first statement, a hiccup is an abrupt contraction of the expiratory muscles, is false. It's an abrupt contraction of the inspiratory muscles to allow a gush of air to get into the lungs. Number 2, the distinctive hic sound is caused by the glottis closure. That's true. Number 3, a hiccup is an evolutionary remnant of earlier amphibian respiration. That's true. Motor pathways of hiccuping forms early during the fetal development, before the motor pathways of normal lung ventilation. That's again true. And number 5, premature infants spend 2.5% of their time hiccuping as the lungs are not fully formed. That's true. On the pathophysiology of hiccups, 1. Hiccup reflex activates the dopamine, the serotonin, the calcium channel, and gamma-aminobutyric acid pathways in the brain stem. Number 2. A hiccup are frequently confined to the right hemidiaphragm cross. Number 3. Hiccups last for 35 milliseconds and can repeat 4 to 60 times in a minute. 4. Hyperventilation, leading to washing out of carbon dioxide levels, decreases the hiccups rate. Number 5, in patients with a tracheostomy, hiccups can lead to hyperventilation, which is false, which is true. Answers on the pathophysiology of hiccups. Number 1, the hiccup reflex arc activates all these pathways, the dopamine, the serotonin, the calcium channel, and the gamma-aminobutyric acid. That's true. And this forms the basis for all the medications and the treatment of hiccups, medications to block these pathways. Number 2, hiccups are frequently confined to the right hemidiaphragm. That's false. Hiccups are almost always unilateral contraction of one cross of the diaphragm, but this cross is mostly the left, not the right side, that gets contracted. Number 3, hiccups last 35 milliseconds and can repeat 4 to 60 times. That's true. Number 4, hyperventilation leading to reduced carbon dioxide levels decreases hiccups. That's false. Hiccups, in contrast to normal ventilation, is actually increased by a reduced carbon dioxide level rather than decreased, and vice versa. To stop hiccups, you need to increase the level of carbon dioxide by, for example, ventilating into a bag, breathing into a bag. So this is false. Number 5, in patients with tracheostomy, hiccups can lead to hyperventilation. That's true. In normal persons, a hiccup ends by glottic closure to prevent excessive gushing of air into the lungs by the inspiratory muscles. But with a tracheostomy, when the effect of glottic closure is cancelled, air can gush into the lungs through the tracheostomy tubes. The hiccuping can lead to hyperventilation without a mechanism to stop the hiccup, every hiccup by glottic closure as in normal persons. On the common causes for the hiccups: 1. Gastroesophageal reflux. 2. Irritation of the diaphragm or the phrenic nerve. 3. Hepatomegaly. 4. Gastric stasis and distension is a rare cause. Number 5. Postoperative hiccups. Number 6. Patients with cancer and on chemotherapy. Which is false, which is true? Number 1 is true. Gastroesophageal reflux can induce hiccups. Irritation of diaphragm also induces hiccup, same as irritation of the phrenic nerve. Hepatomegaly induces hiccups. Number 4 is false. Gastric stasis and distension is a rare cause. This is false. Actually, this is the most common cause for hiccuping, gastric stasis and distension after meals or after heavy meals in particular. Postoperative hiccups, operations and anesthetics can induce hiccups, so that's true. And patients with cancer and or on chemotherapy can have hiccups, that's again true. Now to the management of hiccups, starting with home remedies. Number 1, sipping iced water or swallowing crushed ice would help with hiccups, would help to prevent hiccups. Hyperventilation, Valsalva maneuver, rubbing the soft palate with a swab or a finger. 5. Compressing the diaphragm by pulling the knees up to the chest. Number 6. Carotid bifurcation massage, manual massage. And number 7. Applying supraorbital pressure. Which of these would help to stop the hiccuping as a home remedy? False or true? Number 1 is true. Sipping iced water or swallowing crushed ice can help in stopping the hiccuping. Number 2, hyperventilation is false. As just explained, hyperventilation, which washes out the carbon dioxide and reduces carbon dioxide level, would actually induce more hiccups rather than stop the hiccups. To stop the hiccup, you need something like a Valsalva maneuver or breathing in a bag. This would increase the carbon dioxide level, so number 3 is true. Number 4, rubbing the soft palate with a swab or a finger, that's true, same like number 1. Excess stimulation to the tongue or the palate or the pharyngeal mucosa may help in stopping the hiccuping. Number 5, compressing the diaphragm by pulling the knees up to the chest is true. That can also stop hiccuping. Carotid bifurcation massage, this can also help in stopping the hiccups, and the same as applying supraorbital pressure. That's also true. Now on the use of medications to manage hiccups. Proton pump inhibitors, true or false? Dopamine agonists. Number 3, prokinetic medications to help in gastric emptying. Number 4, some antibiotics like macrolides, for example. Number 5, antiflatulent and defoaming agents. Which of these is useful in the management of hiccups? Number 1, proton pump inhibitors, that's true. This is actually a first-line treatment medication for the hiccuping. Proton pump inhibitors to help in reducing and controlling reflux. Number 2, dopamine agonists, that's false. You actually need dopamine antagonists in order to reduce or control the hiccups rather than agonists. Prokinetic medications to help in gastric emptying, that's true. Macrolides, antibiotics, that's false. Macrolides are known to cause hiccups sometimes. Antiflatulent and defoaming agents, that's true. This again will reduce the gastric distension, GIT distension in general, and will reduce the hiccups. Now to specific medications used in the management of hiccups, starting with baclofen, which is a gamma-aminobutyric acid agonist. True or false? The baclofen would reduce the spastic contractions of muscles in neurological conditions. It has a central and peripheral effect on vagal efferent nerves. Number 3, it can induce transient relaxation of the lower esophageal sphincter and increase reflux. Number 4, it has to be taken with caution in the elderly and also in the patients with renal dysfunction. And number 5, among the side effects are ataxia, delirium, dizziness, and sedation. which is true, which is false. Gamma-aminobutyric acid agonists can actually reduce the spastic contraction of skeletal muscles in neurological conditions. That's true. It has a central and a peripheral effects on the vagal efferent nerves. That's again true. It induces transient relaxation of the lower esophageal sphincter and increase reflux. That's false. It actually does the exact reverse. It reduces the transient relaxation of the lower esophageal sphincter and is used sometimes in the management of resistant reflux disease. Number 4, the baclofen should be taken with caution in the elderly. That's true. And in patients with renal dysfunction. That's again true. And the side effects include ataxia, delirium, dizziness, and sedation. That's true. Another specific medication used in management of hiccups, again, it's a gamma-aminobutyric acid agonist, gabapentin this time. Number 1, it's an analog of the inhibitory neurotransmitter, the gamma-aminobutyric acid, used in the treatment of epilepsy and other skeletal muscle contractions or spasticity. Number 2, it's used in the cancer and in the palliative medications for neuropathic pain management. Number 3, it's used for the blockade of neural calcium channels, and it increases the release of the gamma-aminobutyric acid. So it has dual action here. It blocks the calcium channels and increases the release of the GABA. Number 4, it's used in patients with hiccups, related CNS pathologies such as brain tumors. And number 5, its side effects are more problematic than other anti-epileptic agents, which is true, which is false. Gabapentin is an analog of gamma-aminobutyric acid inhibitory neurotransmitter used in the treatment of epilepsy. That's true. It's used in the cancer and the palliative medicine for neuropathic pain management, gabapentin. That's again true. It blocks the neural calcium channel and increases the release of gamma-aminobutyric acids. That's true. It's used in patients with hiccups related to CNS pathologies like brain tumors. That's true. This would be the medication of choice in hiccups related to CNS pathologies. Number 5, its side effects are more problematic than other anti-epileptic agents. That's false. It's far less problematic than other anti-epileptic agents. 5 is false. We move to another group of medications used in the management of hiccups, this time dopamine antagonists, with 2 specific medications in this group, the chlorpromazine and the metoclopramide. Starting with the first 4 statements relates to the chlorpromazine and the last 2 to the metoclopramide. Chlorpromazine was the only medication approved for hiccups by the United States Food and Drug Administration. Number 2, it acts centrally in the CNS by dopamine antagonism. Number 3, it's recommended as the first-line management. Number 4, its side effects includes hypotension, urinary retention, glaucoma, and delirium. The last 2 questions relating to the metoclopramide. It has both a central antiemetic effect and a peripheral prokinetic effect to enhance gastric emptying. The number 6, metoclopramide, is useful in hiccups because it promotes gastric emptying and reduces both gastric distension and gastroesophageal reflux disease, which is false, which is true. Chlorpromazine was the only medication approved for hiccups by the United States Food and Drug Administration. That's true. This was the first one and the only medication at one time. It acts centrally by dopamine antagonism. That's true. It's actually a dopamine antagonist. Number 3, the side effects include things like hypotension, urinary retention, glaucoma, and delirium. That's true. Number 4, it's recommended as first-line management. That's false. This is because of the side effects. So it's no longer recommended as a first-line management. Number 5, the metoclopramide has both central antiemetic and peripheral prokinetic effects. That's true. And the metoclopramide is useful in hiccups because of promoting gastric emptying by the prokinetic effect and reducing the gastric distension and GERD. That's true. And now to the invasive type of therapy and the treatment of persistent hiccups. Number 1, which cross of the diaphragm is contracting during the hiccups has to be established before any invasive therapy. Number 2, ipsilateral stellate ganglion block is useful in persistent hiccups. Number 3, ipsilateral stellate ganglion block can cause immediate bilateral Horner's syndrome. Number 4, permanent phrenic nerve transaction should be preceded by a nerve block with a long-acting local anesthetic. Number 5, serious impairment of the pulmonary function can occur after diaphragmatic paralysis by a phrenic nerve transaction, for example. Which is true, which is false. Number 1, which cross is contracting has to be established before the invasive therapy. That's true. It's usually the left cross that causes the contraction, but you would have to confirm this by fluoroscopy before any invasive therapy, before doing any invasive therapy, that it is the left side rather than the right which is causing the problem. Number 2, ipsilateral stellate ganglion block is useful in persistent hiccups. That's true. One of the pathways of the hiccups arc are the sympathetic pathway, and blocking this at the stellate ganglion in the neck can be useful in the management of persistent hiccups. Number 3, the stellate ganglion block, the ipsilateral block of the stellate ganglion, would cause immediate bilateral Horner's syndrome. That's false. It will actually cause immediate ipsilateral Horner syndrome. So we always inject only one of the two stellate ganglions based on the confirmation of which cross of the diaphragm is contracting. And when this injection is carried out, you would get immediate Horner syndrome due to the blockage of the sympathetic pathway by the injection. So this is false. It's unilateral, ipsilateral rather than bilateral Horner syndrome. Number 4, permanent phrenic nerve transaction should be preceded by a nerve block with a long-acting local anesthetic. That's true, because we can never be sure of the effects of a phrenic nerve transaction on the pulmonary functions and how the patient is going to cope with this. We usually start first by doing something reversible or short acting like a local anesthetic before moving to actual nerve transaction, which is permanent. Number 5, serious impairment of the pulmonary function can occur after the diaphragmatic paralysis. That's true. Some patients could actually cope with this procedure and continue ventilating their lungs with the action of the other inspiratory and expiratory muscles, but some patients can have serious impairment of the pulmonary functions, particularly the elderly. By this, we come to the end of this presentation with MCQ questions on intractable hiccups for ENT trainees and students. Assalamu alaikum.